So thank you very much for inviting us today to be here. I was talking about the fact that I went to, I think, one of the first and second original Gay Men's Health Summit a long time ago. It was held in Robson Square. And I really want to congratulate Rick and Terry and Olivier for continuing this meeting. It's really a cool set of meetings, and I don't think we should take it for granted that it goes on. I also want to start off today by acknowledging all the co-authors that I have here. So Robert Birch is here, Jamie Forrest is here, and Ashley is here. Alan is somewhere in the back. So if there are any difficult questions, you can send them right to them. Okay. Who's not here today are the people in red, are Robert Hogg and David Moore, who unfortunately couldn't be here, and they're the principal investigators of these two grants that let us continue the Momentum study. Okay, so what I want to do today is actually fulfill three different goals. Very quickly to describe the Momentum study, then to introduce and adapt the concept of positive deviance, and then to use this concept in an analysis and an interpretation of momentum data. Momentum essentially asks if Vancouver gay men's beliefs and behaviors change in response to the province's expansion of HART and adoption of the treatment as prevention paradigm. Specifically, it hypothesizes that this may give rise to HART or treatment optimism, reflecting changing gay men's perception of HIV/AIDS risk, leading to a subsequent increase in the use of recreational and/or sex drugs, and finally, a resultant increase in high-risk sexual behavior. Momentum uses respondent-driven sampling to recruit Vancouver gay men who meet the following eligibility criteria. Gender identify as a man, regardless of his sex at birth, be 16 years of age or older, report having sex with a man in the previous 6 months, receive an RDS voucher for participation in the study, or be invited to be an initial seed recruit, be able to complete a questionnaire written in English, and reside in Greater Vancouver Regional District. Men who want to participate in the study then go to the study office on Burrard Street and complete the following. First of all, an informed consent sheet so they can sign up for the cross-sectional and/or the longitudinal cohort study, both of which are part of Momentum. To complete a computer-assisted interview, which asks about sexual history and identity, substance use history, socioeconomic and demographic information, and psychosocial scales. And then finally, there's biological testing for HIV and STIs, with the results going to the BC CDC and then to the respondent's personal health provider. If the participant doesn't have a personal health provider, then the project will help them find one. Finally, then, they receive an honoraria and RDS vouchers so that they can recruit their colleagues later on. Next, let me please introduce the concept of positive deviance. This originated in child nutrition studies in resource-poor countries where malnutrition rates were high. Positive deviance were actually children who remained well-nourished over time in these circumstances. Investigators would first identify these children and then search for parental strategies that they used to avoid malnutrition. Since its inception in the 1970s, this methodology has been adopted by the WHO, Save the Children Fund, and UNICEF. This slide presents male height growth from ages 5 to 20. In this diagram, positive deviance would be children whose scores fall within the red circle, way above the median or the midpoint of the growth curve, and that really denoting here the 98th centile of the growth curve. In 2008, Samuel Friedman and colleagues applied the concept to people who use injection drugs but remain free of HIV and Hep C infection over long periods of time. Paralleling the original concept, Friedman and colleagues were looking for what they called indigenous prevention tactics, which they defined as behavioral rules or practices that help subjects control their personal risk, even though they have engaged in high-risk activities for lengthy periods. This paper asked the question, can we adopt this concept to momentum data? Well, yes and no is the answer. First, we need to change some terminology. To to begin with, we need to replace indigenous, which sounds aboriginal here on this coast. I thank Robert for that. With emic, an anthropological term which means internally constructed rather than externally imposed. We also dropped the term positive, which of course is associated with serostatus. Since Momentum recruits both HIV positive and HIV negative men, we lose the focus on staying HIV infection-free for long time periods. Finally, we also suggest changing prevention tactics into the more recognizable term harm reduction behavior. We suggest that this is a better fit since it's well established that gay men practice emic harm reduction strategies with respect to sexual behavior and substance use. In the first regard, we include serosorting, strategic positioning, withdrawal, condom use, amongst others. In the latter, studies have noticed doing testers and not mixing substances as harm reduction strategies. So what we're now looking for are emic harm reduction strategies by which gay men protect themselves and, equally important, their partners from sexually transmitted infections in particularly high-risk situations. Because of these changes, we need a new definition of risk. Rather than injection drug use, we propose number of sexual partners. Research demonstrates that frequent, possibly concurrent, sexual partnerships increase the risk of condom failure and are independently associated with unprotected anal intercourse amongst gay men. Therefore, in this study, we used responses to the Momentum question asking about the number of male sexual partners in the past 6 months as an initial measure of risk. This slide presents the resulting distribution of partners reported in the past 6 months for 452 men. As can be seen, the distribution is highly positively skewed. It's really skewed way to the right, with a few men reporting a large number of partners. As a result, the standard deviation is more than 8 times the mean value of 15. This non-normal distribution suggests that better descriptive statistics would be the median value of 5 and the modal, or the most commonly occurring, value of 1. To understand factors associated with this distribution, we use negative binomial regression analysis, with the dependent variable the number of recent male sexual partners. Keith Chan ran the SAS procedure freak subroutine for bivariate analysis and the procedure called GenMod for the subsequent multivariate analysis. Independent variables with a probability less than 0.2 were included in the multivariate model. Independent variables included reported substance use in the past 6 months, specific sexual behaviors, demographic and psychosocial measures, and seroadaptive strategies. Measures in green were significant in the bivariate model, while those marked in red were statistically significant in the final multivariate model. These final significant statistics, independent variables, are shown in this slide. These include receiving money in exchange for sex in the past 6 months, attending a group sex party, which would include private parties, blackouts, or darkroom events during the same time period, fisting, always being the top, rimming, ecstasy use in the past 6 months, and the number of lifetime partners with whom the respondent was the top. And corresponding adjusted risk ratios denote the number of partners relative to those who did not feature the specific behavior. For example, men who attended group sex events in the past 6 months would have, on average, over 2 times the number of partners than men who did not. In particular, we wish to draw your attention to the variables in red. We interpret these with regard to previous studies conducted with Australian gay men, which identified 2 related sexual subcultures: sexual adventurism and intensive sex partying. The first is defined as a rejection of vanilla sex practices and replacement with group sex events, sex toys, fisting, and rimming. 3 of these 4 factors are significant variables in this analysis. Intensive sex partying is defined as frequent attendance at group sex events where illicit substances are commonly used. Again, both factors were significant final variables. Australian researchers stress that intensive sex partying is a rational attempt to maximize pleasure and sociality. This interpretation draws attention to the importance of pleasure, which is often undervalued and understudied in relationship to risk in HIV research. Interviews with Australian men engaged in intensive sex partying also revealed safety concerns, so-called self and others, that is, with sexual partners. This analysis found one such emic harm reduction strategy, always being the top. In addition, finding that other seroadaptive strategies, including avoiding anal intercourse, disclosing one's serostatus, and using condoms, were not statistically significant, argues for the presence of sexual adventurism in this sample. To summarize, to this point, we've 1, introduced the concept of positive deviance, 2, adopted this to denote emic harm reduction strategies for high-risk sexual behavior by using the number of recent male sexual partners as a risk measure, and 3, performed a multivariate analysis that identified 2 gay subcultures in the momentum data. From this, we can now pose the 2 questions, so what, always an important question, and what next? Let's start with so what. With respect to the first question, analysis identified culturally and epidemiologically important phenomena. For example, more than 1/4 of the sample reported attending group sex events in the past 6 months. Secondly, analysis suggested 2 related gay subcultures that emphasize pleasure and sociality. Thirdly, analysis identified one emic sex-positive harm reduction strategy. What to do next? We propose a mixed method approach to further explore these results. First, for the quantitative data, we'll run the analysis again at the conclusion of the initial recruitment wave, now scheduled for the end of this calendar year. Momentum has now interviewed over 625 men, or 175 more than included in this analysis. We also want to test further the idea of distinct subcultures. We can do this by conducting a logistic regression analysis to determine if men who attend group sex events differ with respect to sexual behavior, substance use, and psychosocial variables from men who do not attend such events. In terms of qualitative data, we want to recontact men who have reported attending group sex events and interview them to find out more about how such events are organized and advertised, and to understand more about sexual adventurism and intensive sex partying. In particular, we'd like to know if group sex attendees recognize these 2 distinct subcultures that the quantitative analysis suggests. And finally, we want to ask about other potential harm reduction strategies. So let me close now by showing all the people who have made this possible, from the funding agencies, the research program coordination, our academic investigators, our community partnerships, in particular, YouthCo, Positive Living Society and HIM, clinical coordination and STI clinic, STI screening, and our research collaborators in California. Thank you very much.